Heroin has become a rampant killer across the United States. In 2015, the Centers for Disease Control and Prevention said use of the powerful narcotic had reached an epidemic level. More than 8,200 people suffered fatal heroin overdoses in 2013. In late 2016, the Virginia Department of Health declared opioid addiction a public health emergency. The state cited a nearly 90% increase in heroin overdoses from the previous year. Sadly, the tragic numbers continue to rise. Heroin is so addictive and dangerous that it's threatening every community and segment of society. Men and women of all ages and all income levels. Even in Henrico County, the illegal drug is destroying lives and livelihoods, and it's shattering the notion of what an addict looks like.
You wouldn't picture this, me walking down the street. A normal person wouldn't look at me and say, oh, he used to shoot heroin and crack cocaine in drug dens and on the street. There's a stigma associated with addiction. People have this idea of what an addict looks like, and it's not this, This disease of addiction doesn't discriminate, does not care race, age, wealth. I grew up in an upper-class family, private school, college graduate, and I still ended up at a point of desperation. I had no relationships with my family. I had, a title loan on my car. I had no house. I had nothing except the drugs. I had a relationship with the drugs, and that was it. I asked for help, and luckily my mom, she knew how to love me from a distance, but when I finally asked for help, she took me immediately to the McShin Foundation because they gave me a bed and a detox on the same day that I asked for it. And I've been here ever since.
Heroin, opiates, they have a magical ability to stimulate the parts of the brain that are there to help a human feel a sense of pleasure, a sense of well-being. Opiates have a pass into that part of the brain, a key, if you will, to the lock that unlocks this feeling of reward. So that all that an opiate user has to do is put the drug into their body, and they get this very powerful, immediate feeling of great reward. And so naturally, a proportion, it's not universal, but a good percentage of people feel a great sense of pleasure when they take a drug like morphine, opium, heroin, and they find themselves seeking it out. And it's almost an automatic response. That is the first inkling of abuse.
My drug of choice was to get high. Heroin got me the highest, so that's what I like to do. It didn't matter. Of course I started taking pills before that, but pills are hard to find. They're not as readily available as heroin is, and it's much more expensive. Yeah, it's way easier than most people think. I can go to any neighborhood in the Richmond area and tell you where to go to get heroin.
Addiction in a nutshell is when a person is using a drug of abuse, a drug that induces dependence. They're using it despite negative consequences. They continue to use even though bad things are happening to them, and they know it. And they want to stop, but they find they can't. That's addiction. As time goes by, it is the nature of this illness, it's inevitable that the consequences of using the drug, they grow in the severity, in the frequency, the repercussions get worse. Then as things become more serious, somewhere along the line, they have interactions with law enforcement because they're usually breaking the law at this point.
I started doing things that I never thought that I would do. And then once I started shooting it, it was a death trap. It was on. That was the end of my life as I knew it, really. I was living to use and using to live. I couldn't go a couple hours without shooting heroin. I was literally living in a movie. I was riding around with drug dealers, committing crimes, selling drugs, using. I was robbing stores. I was, ripping and running in the public. And so not only was I hurting myself, I was hurting my family, I was hurting relationships, I was also hurting the community.
What we're seeing and what we're facing in Henrico is really no different than what we're seeing or what the rest of the country is experiencing. In Henrico County, in the last 2 years alone, we've seen probably close to a 150% increase in opiate-related use and abuse. And now in 2016, we're looking at another triple-digit increase over 2015. So the problem here is grave.
There seems to be two different groups of people who are struggling with heroin, and the one that receives a lot of attention is kids who are experimenting with drugs, and starts with alcohol and then maybe marijuana or prescription pills and then on up to heroin. And it's scary how quick that transition can happen. The other group that doesn't get talked about quite as much is otherwise healthy, law-abiding adults who, for whatever reason, require surgery and pain medication. After taking the pain medication, whether it's morphine or Dilaudid or something else, develop an addiction to that pain medication. And once they can no longer get the prescription, then unfortunately drugs like heroin have become readily available.
What we're seeing now with opiate use and heroin especially is that the more we crack down, the more monitoring systems we get on the pharmacies and the doctors, the more we're seeing people able to switch over to, so pills are becoming harder to get and they're becoming more expensive. So it's easier to switch over to heroin. It's cheaper, it's easier, it's quicker, it's just as effective, if not more. So I think that's what, I believe that's what we're seeing.
Behind the sad statistics are families and loved ones who will never be the same. Lori Pettit lost her son Dawson to a heroin overdose in 2014. By sharing their struggle, she hopes to protect others from the ravages of the drug.
We just, we weren't educated enough, and that's why I do what I do now, because I can't go back and I can't do the coulda, woulda, shouldas, and I can't change what happened, but I can educate myself now and hope that nobody else has to go through this. He was a great kid. He was very happy all the time. He was a very quiet baby. He was well-rounded. He, had a lot of friends. He was always smart. Learning came very easy to him. He entered Deep Run High School and he made the National Honor Society, but he had a few indiscretions. He was not an angel. He experimented with alcohol and pot. Then he wasn't a great big partier, but he definitely experimented. He went off to college. He got accepted to all 3 colleges he applied to, and in his senior year at JMU, Dawson was the victim of a home invasion, and he was beaten up pretty badly, and it changed his life. He never went back to JMU, but he said it was the beginning of a downward spiral for him.
In his desperation, Dawson began forging prescriptions to get painkillers. That led him to heroin. At first, he snorted the drug, then injected it. Dawson was hooked.
At that point, when we realized he had a problem, he was over 18, so he wouldn't go away. He had to agree to go, and he acted like he didn't have a problem. And he had detoxed himself, we learned later, by himself. But we put him in a program here in Richmond. It's an IOP, intensive outpatient program. But we didn't feel like he really embraced the program. He didn't get a sponsor, he didn't go to meetings. Again, ignorance played such a big part of not teaching ourselves about the disease. I mean, I was the one, I am the person that sat right here and looked right at him and said, just stop, just stop. And now I realize that he was in the throes of a chronic disease that he would have had the rest of his life.
With his family's support, Dawson tried to free himself from heroin's grip. He entered drug rehabilitation programs, but relapsed each time. He died March 1st, 2014, from a heroin overdose. He was 26 years old. Henrico has had programs and systems in place for many years to help residents who are battling substance abuse. But in early 2016, officials decided a stronger, more comprehensive approach was needed to confront the challenges of heroin. Henrico assembled a task force to work with the community and treatment providers, like the nonprofit McShin Foundation.
It's important to note that McShin's open 365 days a year. The building is usually open for about 16 hours a day. There's a fully manned staff for at least 8 to 10 hours a day, every single day. And we're all people in recovery here. Like, we've all been there, we've all done that. We've all found a way out and a way to live life successfully. So we use our lived experiences in an effort to try to show other people. We offer support groups. Everything we do is centered in bettering our community and helping the individuals that come in that struggle with these problems. This is David Rook from the McShin Foundation. I'm just returning his phone call. It was a good experience. It was good to be invited to the Henrico Task Force. You know, it was definitely an opportunity to go in and kind of hear where they were going, and to also have them open up to community resources like the McShin Foundation. There was lots of people around the table, you know, from law enforcement to the community mental health services. The truth is, you know, it really takes all those people around the table to understand that it's going to take all of us working as a cohesive unit to really get that done.
Well, not only did we hear from those groups, but we spoke with over 60 other groups or people in the community. So doctors, family members, private providers, people with addiction have come and spoken to us. And really, I guess we already knew it, but it just was reiterated as how overwhelming this problem is. But the really good thing was we all were working on it in our little silos, and this really helped us all come together and make it a much bigger joint effort.
For anyone struggling with substance abuse, Henrico Area Mental Health and Developmental Services represents a gateway to a network of help and support.
Stepping back and worrying about me, because I can't take care of anybody until I deal with.
We have what's called walk-in for those with substance use disorders. So 4 days a week at this site and 3 days a week at our East End site from 9 to 3, anyone with a substance use disorder can walk in and say, I need help. And we'll see them immediately and we'll open them to services if that's what they need. And then we'll immediately start working with them on whatever it is that they need. If they need detox at that moment, we'll help them with that. If they need medication-assisted treatment, we can partner with them and another agency and try to get them some medication assistance. So they can really be open the same day that they walk in.
The Henrico Police Division has stepped up its efforts to protect the community from illegal drugs. The challenge is twofold: keeping heroin and other drugs out and connecting users with the help they need.
Every day we go into the areas that we've received complaints that people are either using or selling heroin or any type of drugs. I think the average person they see what they see on TV, but they don't really realize how bad it is. I think we started to see a lot more eyes opened when we started to have a lot more overdoses. All right, they're making a turn on Sussex now. Turn on Sussex now. You'll get a drug overdose call probably at least once a day. And when you get there and somebody has actually overdosed and died, it's a sad scene because you've got the family there. The family is distraught. They've walked in, they found their loved one, with drugs laying around them or a needle even laying in their arm. And it's just a really sad situation knowing that, it can be avoided. Heroin addiction or any drug addiction is a disease, and it's a disease that needs to be treated. I think the medical community, the behavioral health community all think that the police just want to lock up these drug users and put them in jail and throw away the key, and that's really not the case. We found that the best way to handle this is by having compassion for these folks, offering them the resources that we have available to us so that they can get help, because that's the ultimate goal. And we'll tell them straight off, our ultimate goal is that you get sober. what's huge about what we're doing right now, and I think our entire group, our team, all feel that we are making a difference on a daily basis. You know, people look at us, oh, all you're doing is, you know, you're just locking up junkies. It is making a difference in these people's lives. If we save just one person from overdosing, then we're successful.
While traumatic, an arrest is often a blessing for a drug user. The Henrico Sheriff's Office offers several programs to help inmates with addictions. These include a general program called RISE, Recovery in a Secure Environment, and one tailored to opiate users called ORBIT, Opiate Recovery by Intensive Tracking. These programs mark a departure from the past when few treatment options were available behind bars.
For some time, we've been noticing the number of heroin addicts that we have come into jail. You know, we detox about 100 inmates a month off of opioids. So, I mean, it's been a huge problem. You know, when you're addicted to a drug, your life is out of control. So if we can control them long enough to gain control back over their lives, I think they have a better chance of making it.
I'm a heroin addict. My life consisted of living to use and using to live, waking up every morning and having to have it. If you don't, you're sick, you're not able to get up, living in and out of hotel rooms, just no life, no possibility of getting a job, no possibility of going to school, no nothing. This is what I'm living for. I'm living to use. You know, my last week of using, I was literally on a suicide mission. I've completed the 2 phases required of the RISE program. I'm somebody that has been a repeat offender. This time, I feel hope. I feel like things are going to be different for me. I'm giving myself a chance. I'm paying attention. If people tell me that I'm doing things the wrong way, you know, I take a second look at myself, you know, and try to learn to do things different. That's something I've never tried to do before.
You know, you hear the argument all the time, treatment versus incarceration. I really believe that incarceration is the best time for treatment. And if we use the resources we have to help people, that it benefits them tremendously.
Love, support, treatment, and greater awareness may indeed save lives. But for those struggling with addiction, being honest about the consequences they face is critical.
I think naive and denial play a huge role in it. Like they don't want to admit that it's in their backyard. You know, they don't want to admit that their son or daughter is addicted to heroin because there's that stigma associated with it. It's one thing if, you know, your son or daughter drinks too much or smokes too much weed. You know, people are like, oh, okay, well, you know, that's okay, we'll figure it out. But when you say heroin, people cringe. You know, there's this whole nother, it's taboo. No one wants to talk about it. And until people start talking about it, like alcohol and marijuana, you know, then it's never gonna change.
When it comes to the opioid crisis that we're facing, there is no way to sugarcoat it. There is no way to soften the message. It is a nasty message, and it's a very graphic message. Nothing good comes from an opioid or heroin addiction. This is a horrific, and when I say horrific, I'm talking, I don't know how else to describe it other than it's emotional, it's physical, it's physiological, it transcends about every barrier there is.
My message would be to educate, to change the stigma, to realize that addiction is a disease, it's a chronic disease. Don't give up hope on your child. I am helping people now. People will call me with their questions about their children, and I say, don't give up on them. And I guess my motto would be not one more, because I just don't want to see anybody to have to go through this again.
Advocates agree recovery is possible for any user who's committed and willing to work for it.
I'd definitely either be in jail or dead, no question. And a month after I had gotten clean, the cops raided the house I was staying at, and everyone ended up getting arrested. So I was going down the path of death or jail. And to be honest, I didn't care. I was so wrapped up in the disease that I didn't care if I died. I didn't care if I went to jail. That was the life I was going to live, and I was okay with it. That's the insanity of it. You know, and it's funny, ever since I've gotten clean, I haven't done anything illegal. Which, you know, for a normal person, that's like, well, duh. But for me, you know, it's a big thing to have my, you know, name on a lease. It's a big thing to have a bank account. You know, it's a big thing to have a relationship with my mom. You know, I mean, those are all things that people take for granted. And for an addict like me, those are all huge milestones for me.